chained to walls, starved, left to rot. Medieval mental asylums weren't places of healing. They were nightmares. Patients weren't patients. They were prisoners. No rights, no diagnosis, just pain. And the treatments? Ice baths so cold they'd knock you unconscious. Teeth yanked out to let the demons escape. Holes drilled into skulls. All done in the name of medicine. But here's the part no one talks about. Some of these so-called hospitals are still standing. The year is 1247. London opens its first mental institution, Bedlam Royal Hospital, later nicknamed Bedlam. It wasn't a place of care. It was a warehouse for the unwanted. Screams echoed through the halls. Visitors paid to gawk at patients like they were animals in a zoo. Some were violent, many weren't. Didn't matter. If you were poor, different, or inconvenient, you could end up in Bedlam, and once you were inside, there was no getting out. Treatments were worse than the illness. Bleeding, burning, whipping. They believed madness came from demons, bad blood, or moral failure, so they tortured the body to save the soul. One method involved spinning patients in chairs until they vomited or passed out. Another, trepanation. They'd drill into your skull to let the evil spirits out, and if that didn't work, they'd chain you to a wall and leave you there. Some patients weren't even mentally ill. Wives sent by angry husbands, elderly dumped by their families, women who spoke their minds called hysterical, men who questioned authority labeled mad. And once you were in, it didn't take madness to break you. Darkness, isolation, hunger. You'd sleep on straw. Rats would keep you company. And the guards, they weren't doctors. They were jailers, often drunk, often cruel. They beat patients for fun. Some starved to death. Others just disappeared. And yet, this wasn't unique to England. In Spain, the mentally ill were branded with hot irons. In France, some were chained in underground dungeons, never seeing daylight again. In Germany, exorcisms were common. Priests screamed prayers over convulsing bodies, convinced demons were inside. Medicine? Science? Those words didn't mean much. Fear ruled. And fear created monsters in white robes and religious collars. By the 1600s, asylums were booming, not because they cured anyone, but because they hid society's shame. Cities were proud of their asylums, out of sight, out of mind. Royalty funded them, churches endorsed them, and the public? They treated it like entertainment. Inmates were displayed like circus acts. People came to laugh, throw coins, or rocks. It wasn't just cruelty, it was culture. And inside, the care only got worse. Patients were forced to wear chains that weighed more than they did. They were gagged to silence screams. And if they resisted, ice baths, shock torture, or worse, straight into a coma, induced with opium or alcohol. They called this progress. Over time, they gave these horrors names: moral therapy, rest cures, behavioral correction. But the results were the same: pain disguised as treatment. Even into the 1800s, not much changed. American asylums copied Europe's worst ideas. Doctors still believed illness was punishment from God, or weakness of character. And the cures? Ice water injected into the spine, electric shocks to the head, or worst of all, lobotomies. A sharp tool hammered through the eye socket. Twist, scrape. Done. Personality erased. Human gone. Quiet achieved. Lobotomies became a trend. Thousands performed across Europe and America, sometimes on children. Doctors got awards. Patients got silence. And those who survived often couldn't feed themselves, couldn't speak, couldn't remember who they were. Families were told it was a miracle, but it was just control. The quiet wasn't healing. It was compliance. The truth is, mental asylums didn't evolve to help people. They evolved to make the problem disappear. And even today, their shadows still linger. Some of those buildings still stand, empty now, but the walls remember. Tour guides tell sanitized versions, a bit of history, they say, but the stains on the floors, they're real. And in places like Bedlam, they say, you can still hear screams echoing at night. Not from ghosts, but from a truth too many would rather forget. Her name was Margaret. In 1811, she was admitted to a London asylum. Diagnosis: nervousness. Translation: she was grieving too loudly after her child died. They stripped her, bathed her in ice water, and locked her in a padded room. She stayed there for 38 years. When she died, nurses found scratch marks on the walls, hundreds of them, one for every week she spent alone. Then there was John, a war veteran from France, came back from battle hearing voices, shaking in his sleep. Today we'd call it PTSD. Back then, possession. They chained him to a bed, fed him bread soaked in vinegar. He died within a year. His file read, "Soul lost to madness." Or Anna, just 15 when she was brought in by her father. She liked to draw. She talked to herself. They called it hysteria. Within months, she stopped speaking altogether, but even in silence, she kept drawing, with her fingers on the floor, in her own blood. Madness wasn't seen as a condition. It was a punishment, a curse, a mark of sin. Some believed it came from the devil crawling inside your body to twist your thoughts. Others said it was caused by bad blood, blocked bile, or wandering wombs. Yes, they believed a uterus could float around and make women insane. For men, the cause was often said to be masturbation or disobedience to God. Treatment: prayer, bloodletting, confession, or worse, exorcism. Priests would shout at patients for hours. They'd beat them with holy relics, pour scalding water on their backs. If the patient cried, they said the demon was resisting. If the patient begged to stop, they said the demon was mocking them. And if the patient died, they called it a spiritual victory. Forget medical exams. In the Middle Ages, all it took was one accusation. Your husband, your priest, your neighbor, even your own child. If they said you were mad, you were. And the proof? Too quiet? Clearly possessed. Too loud? Unstable. Refused to marry? Insane. Read books? Dangerous. You didn't need symptoms, you just needed enemies. Women were the easiest targets. The term hysteria became a catch-all diagnosis for anything that made men uncomfortable. Cried too much? Hysteria. Laughed too loudly? Hysteria. Had an opinion? Definitely hysteria. And once that word was spoken, the cell door closed. No appeals, no evidence, just silence. And centuries of it. As medicine evolved, the cruelty didn't end. It just got dressed up in lab coats and Latin. Enter phrenology, the belief that bumps on your skull could reveal mental illness. One wrong shape, one abnormal curve, you were labeled defective. And the solution? Surgery. Some had sections of their skulls removed to release pressure. Others were subjected to moral drilling, boring into the brain to restore balance. Then came eugenics. The idea that madness was hereditary, that it should be bred out of the population. Suddenly, asylums weren't just prisons. They were sterilization centers. In the U.S., over 60,000 people were sterilized without consent. In Germany, those same ideas fed the machinery of the Holocaust. The feeble-minded were the first to die. All backed by science. All praised as progress. We like to believe we've evolved, that mental health care today is about compassion, science, healing. But the truth? Shadows of those old asylums still exist. Isolation is now called seclusion. Chains have become restraints. Ice baths have been replaced by chemical sedation. And the people? Still locked away. Still forgotten. Only now, they disappear behind locked psych wards and legal paperwork. It's cleaner, quieter. But is it better? Because when the system fails someone today, we say, at least it's not like the old days. But ask anyone who's lived through it. The screams might sound different, but they're still there. Maybe the scariest part isn't what they did back then. It's how easy it still is to call someone crazy, to dismiss a cry for help, to look the other way when someone's locked behind doors we don't open. Madness didn't disappear. We just got better at hiding it.